welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you very much for having me on the program.
Yes, sir. Before we go into COVID-19, I just wanted to get a quick update from you with regards to the incident in New Amsterdam. I know that has been engaging your attention.
Well, as I said, we had a mother and a child that died, and we launched an investigation into what happened in New Amsterdam. We have a standing committee called the Maternal Review Committee, and they had the opportunity of going there on Sunday, and they were able to interview everyone who were connected with the challenges that we had there. And they have since issued a report. And based on that report, we strongly believe that the doctor who was in charge of the patient seemed to be negligent. And we also believe that the nurses who was involved were also negligent. Based on these findings that was issued by this committee, I'm taking immediate steps to suspend that doctor who was involved in this case and two of the nurses who were involved. And we will have some follow-up actions that we would announce later on. But as of now, the doctor who was in charge and two of the nurses have been suspended.
Okay, sir. Thank you. Could I also ask you for an update on the filaria campaign?
Well, with filaria, as you know, we had started in Region 4 and Region 3, and we are now extended that now. We're in 10 and in Region 6.
Okay.
As of yesterday, we had 321,823 persons who have taken the filaria tablets. And this is a very good response, but we want more people to engage us and to take those tablets. So those of you who haven't taken your tablets as yet, we are encouraging you to do so because we want to eliminate filaria from Guyana. And the only way that we can do this is to make sure that at least about 70% of our population take these tablets.
All right. Sir, before we move on, I just wanted to ask you about the panel that is investigating the situation in New Amsterdam. I'm asking because I wouldn't want people to think that the doctors and the nurses don't have representation either. Are you able to share any of that information with us?
The Maternal Mortality Committee, Review Committee, is chaired by Dr. Neville Gobin, and we have the Chief Medical Officer, and there are a number of other doctors who are part of that committee.
Okay. Thank you, sir. All right. As regards to COVID-19, yesterday we spoke extensively of a lot of measures that government has undertaken thus far, and I want to list them because we talk about more vaccines, the latest being the Sinopharm vaccine from China. And then there were new equipment at the National Public Health Reference Lab and training also. And then there are equipment that going out to the other regions as well to simplify the process, make it more accessible, PCR, antigen testing, and so on. With all this happening, we're still seeing a lot of people who are seemingly careless. And one of the things that we read this morning was that there was a party, people attending, and they were subsequently charged. So I wanted to ask you to address this, and I wanted to ask you specifically if you think that there is lack of education since we started this process, if it could be that, if it could be the economics of the promoter. I'm not sure, I'm asking.
Well, I'm not sure either. In terms of information, I think we have put out a lot of information. I can't see any sensible adult in Guyana who does not understand the implications of COVID. We have, for more than a year now, been talking about COVID, explaining what it is, how it's transmitted, how you can get infected, and what are the measures that you need to protect yourself with. And I think everybody by now should be quite aware. There are simple measures. One is to wash your hands, two is to watch your distance, and three is to wear a mask. I don't know how simple we can make it, but these are the three simple things that we are asking people to do. Yet we find that there are people who have deliberately set out to breach these guidelines, and including organizing parties. Because when you organize a house party or whatever party you're organizing, people go there, they're in close proximity with each other. They don't know who might be a carrier of the disease, because a lot of people can be asymptomatic or mildly symptomatic, and you can get infected in that way. So if people want to avoid infections, then the thing is to avoid these crowded spaces, and to avoid going to things that you know there's a high risk of you getting infected. This common sense. And I do hope that with all the information that we're putting out there, that we get more people to use their common sense and to avoid these places where you can get infection. It's as simple as that. Some people might believe that they are not vulnerable to the disease, that only older people or persons who have underlying illnesses are more vulnerable. And while that is true, we have seen also that younger people who get a milder form of the disease can end up with something that is called long COVID.
Yes.
Because eventually they come back maybe 2, 3 months after, and they have complications of COVID. So, this thing is not as straightforward as people might want to think. And therefore, we want to urge that everybody take these precautions, because it's important that we do so. We know that we are getting vaccines. Vaccines does not mean that we must be complacent. Because while we are getting vaccines, initially it's not going to be enough for everyone, and therefore we still have to take precautions.
Okay.
So I just want everybody to use these common sense measures that we have been advocating, and if we do so, we'll be safe and we will remain protected.
Okay, sir, thank you. I wanted to address something specific, and I want to tap into your clinical knowledge, because we've done some research, and it basically says 1 out of 800 people entering the early middle age, and that would be around 45, will die from COVID infection. And then, of course, we know the 55-year-olds, 1 in 240 are at risk of dying. And so it goes on with older people and so on.
Well,
And I wanted to talk to you about that.
I'm not sure about those stats, but definitely what we have seen in Guyana, there's a pattern.
Yeah.
And most of the persons who have died so far in Guyana are older people or persons with comorbidities.
Yes.
So we just want people to understand that if you are older and if you have comorbidities, that you're more vulnerable, you're more at risk. But that doesn't rule out anybody from getting COVID, right? So it's not just these two groups of people. A younger person would be able to get it if they don't abide by the rules.
Yes.
And some young people also get severe forms of COVID, right? It all depends on your genetic makeup and a whole set of other issues that I guess we can't go into the details of right now.
Yes.
But you have some younger people who would get severe forms of it, and we know that persons with these underlying illnesses would also get a severe form of the illness. So the better thing to do is to make sure that you take the preventative actions while we await getting a vaccine. And when you get a vaccine, at least you would have the antibodies to protect you.
All right. Thank you so much. I wanted to revisit the activities, but more specifically the sporting activity, and not so much who was given permission and so on. But I know that permission was granted, but of course, these would have come with particular measures that were supposed to be.
For any major event, once people apply to us, we would review the event, and then if they are able to put measures in place to comply with those things that we want, like distancing and so forth, and wearing masks, then we would issue permission. However, there are people who treat these things very lightly. So when they get the permission, they feel, well, okay, we don't have to now abide by the conditions of the permission. But we send people to these events to monitor them. And if we realize that people are not abiding by the conditions that we issue with the permission, then what we'll do is that we wouldn't give them any permission in the future. So, you either work with us to make sure that people remain safe, or if you're not going to do that, then we are not going to give you permission to host those events. And that's the case with some of these sporting organizations who, when they come to us, they present a plan that they're going to keep people safe, but when they actually hold the events, they're in violation of the rules that we have put in place. In some cases, we are exploring the option that the persons who would have applied for the permission and didn't abide by these regulations, whether or not these persons can be prosecuted as well.
Okay. All right. And just for clarity, you haven't cut that off. It's still open for anybody who may want to have an event.
It's there, but people must abide by the conditions that we are instituting. We are not just putting these things willy-nilly. We want people to remain safe. That's why there are a number of things that people would have to comply with, including mask wearing. A lot of people show up to events where you have 50 persons and half of them not wearing masks. And they're seeing each other for the first time. So they're not in the same household. So you don't know where the other person have been, whether they've been in contact with somebody who has been exposed. We don't know. And therefore, you are chatting away with that person, and at the same time, you can easily get infected.
Okay, sir. I have one last question for you before we go, and it's from Nightly News. They're asking, and as it's written here, I understand children are not among the priority group for vaccine, but will an exception be made for those who have immunodeficiencies or underlying conditions such as cancer, asthma, etc.? Should schools reopen fully? And they're asking, if the answer is yes, would their parents have to give consent?
I think the question is, I would say, a good question from this point of view. One, there probably is a big misunderstanding why children are not in the priority group.
Okay.
Children are not in the priority group because vaccines that are currently available for COVID has not been tested in children. And it's simple.
Yes, sir.
So we don't have a vaccine for COVID that we can give to children. All the vaccines that are available are for persons 18 years and above, with the exception of the Pfizer vaccine, which is for 16 years and above. And the reason why none of these vaccines are available to children, because when they were doing the clinical trials, they did not include children in any of these clinical trials.
Okay.
So we don't have enough information to see how it would work in children and what dose we should give to children. Now, some of these companies like Pfizer and so forth are now recruiting children and working on clinical trials specifically for children. When that information becomes available, then we would be able to make decisions about the use of the vaccine and the safety of the vaccine in the children population. But as of now, the reasons why children are not going to be vaccinated, it is because the vaccine is not recommended for children. Okay. So it is as simple as that. Then the other consideration that one can give is that in children, when children get COVID, they normally experience a very, very mild form of the disease. And so that's another reason why it's not an immediate priority. But the underlying thing here, the fundamental reason why children are not getting the vaccine, it is because there's no scientific data right now available so that we know the safety and the efficacy of these vaccines in the children population. Once that becomes available, then those decisions are going to be taken.
All right.
Okay?
Yes, sir. Thank you so much for speaking with us today.
Thank you.
All right, well, that's it for today's COVID-19 update. We, of course, just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and, of course, our social media platforms.